Hi guys, good morning. Well, I kind of did a little sneaky. One of my favourite YouTubers, I've watched her for 10 years. Anyway, it was an important video. So I had to watch it straight away because I was like, oh, I've got to know what's going on. Happy news. Anyway, basically, I've got to get in the shower. I've got to go to
Pulmonary respiratory clinic and specialist appointments, 2 in one day.
That's being dramatic. I'm not like that. Well, actually,
you are.
Let's not talk about it.
And you are dramatic.
But basically, let's just do the pre-shower stuff because I mean, look at me. I'm sporting the lovely strawberry shortcake nightie. Anyway, let me brush my hair. You're my mirror. So how are you? I know a lot of you are also battling like me, so I'm cheering you on like I cheer myself on sometimes. It seems to work. I don't know, guys, just go with it. Trust the process. I don't actually even like that saying. Come here, come with me. Come with me to, whoa, okay, there's a bit of a dip in the bathroom there. That's necessary though because of the structure of like, say if this flooded. Oh, look at these bangles. Look at these. These are just to play with in the bath. I know, I'm 2 years old. No, I love bath time. And basically this is like a little mini spa bath. Great for basically getting clean. I have a lot of fatiguing issues and POTS. So when the hot water hits my body, and some of you guys might have this too, my blood pressure just goes bad and I can dangerously end up passing out in the shower screens, right, glass. And also the my heart can't take it. So pretty much every shower I'm taking a spray. But I shower once every 3-4 days for my hair to wash my hair really well. And then I bath in there otherwise. And also before bed for pain, instead of taking a tablet, except last night, the hard stuff came out. Not like that. Why are you thinking of that? No, like what I mean is tramadol had to be used. I was in agony. I don't know what's going on.
Heavy hitting pain medications.
So, look how pretty that. These are Shein. I've got a Shein haul coming today. I will record for you when I get back.
She's got another
hospital.
Shein. Another Shein.
Right, I've got to balance.
Shein, again.
Well, they've been
It's incredible.
Late
wait, just wait to see what she's
late.
got. You better subscribe and hit that notification bell and find out what's going on. Right, you're organised for getting in the shower.
You're late for a very important date. Things to do, places to go, people to see. Dramatic. He's being dramatic and I'm rushing. And it's cold in Perth, so I get to wear a nice tracksuit. I've got a lot to choose from, so that's going to be hard. And hospitals are cold in Australia. Freezing. It's like, oh, welcome to Alaska. That's what they should say at the entry to the hospital. Welcome to Alaska. Because it's freezing. That's how cold it is. Whenever I go in there, I think it's because like I'm thin. They look at me and they go, would you like an extra blanket? And I'm like, because I'm actually also someone that likes to be super warm, which is not good. But anyway, yes, sorry, you can't see me. Hi. All right, look at that. That's pre-shower. I'm going bald. No, this was a joke I was just having with my carer this morning. She was just saying to me like how much hair when she brushes it, because she's got beautiful long hair. Actually, I've got a few carers with beautiful long hair. Now mine is long to there, but they've got it like even longer basically. And it's just beautiful. And so basically, yeah, I've got the same thing. A lot of this for me is my anti-seizing meds. It's not good stuff, but you know, it stops me seizing 6 to 10 times a day. So I'll take it, thank you. All right, let's go over here. So the heart monitor was put on me last night and it went down to what again, sorry?
35. It was sitting in the low.
35 beats per minute.
It was actually sitting in the low
For hours.
low to mid 30s for
Early
about
hours of
5
the
to
morning.
6 hours. So really suppressed heart rate overnight. But anyway, it is
But
what it is. But
and
a
we're
lot of
going
spikes
to
in between.
Yeah, and we're
Lots
going
of
to
spikes.
respiratory. But we really need cardiology because this is a cardiology connected problem. But it's a process of like, but we've got to go through that to rule out anything else. It's like, well, I'm not smoking, so it's not COPD or it's not what's emphysema. So let's just move on now and go to and see even, guys, forget about like just the low 70s and 80s. Well, don't forget about it. It's pretty important. But 92 and below is therapeutically bad for the brain. And you know how my stutter, look, I don't tend to do videos when I'm at my worst. I should actually. I'm going to bring out the camera next time I have a very, very bad stutter moment. Camera's coming out and then you get to see it because it really is a struggle. But basically, I need to be up to 92 minimum for most of the 24 hours, 7 days a week. Yeah, that's where I should be. Otherwise, what happens is brain damage. And that is not good. And that means you lose things like speech, memory, all these sorts of problems. So, anyway,
Have you got
I'm getting in the
clothes
shower.
organised before you come?
Oh,
so that
what
way
am I
we've done
going
that.
to wear?
So you need to determine what you're going to wear.
Right.
We also need to probably get the air conditioner ready in case you overheat.
I'm thinking
Orthostatic intolerance means Dyan actually overheats, and showering is actually a big deal when you actually have POTS, postural orthostatic tachycardia syndrome. So normally she would actually use the nitrolingual spray, the GTN spray, just prior to getting in. But we can't do that because that will actually affect the pulmonary test.
Brown.
You're going for a brown koala look today, are we?
Brown.
Why not?
Then,
The brown koala look it
do I
is.
have- Oh, did he scratch my ribbon?
Okay, are you getting distracted again? She's getting distracted
Okay,
again.
so basically
Yeah.
what goes nicely with that, have I got something that's... Oh, I love this cardigan. Do
Okay.
you think this cardigan suits that colour?
It will. It's 14 degrees in Perth at the moment,
Guys,
but it can be quite
look at
warm
this
in
cardigan.
hospital and clinics as long as you can
oh
take it
my
off.
goodness, it's me.
It's definitely you.
It's so Denmark
It's
as well.
Definitely her.
Western Australia,
Are you going to choose
Denmark.
a t-shirt to go with it?
Of course I am. So I'm
Good.
wearing this and it's so soft.
Let me put that one away for you while you're fluffing
Thank
around.
you.
Grab a t-shirt.
Right, so a long sleeve t-shirt is what I'm going to wear because it's going to be freezing. Okay, long sleeve t-shirts. Here. This is, guys, I have drawers there, that, and boxes below. I have an addiction to clothes.
I'm coming into your ear.
I take after my mother in that sense.
You do have an addiction to clothes.
But, you know, and there's a Shein order and I don't even remember what's in it.
Sorry, just bear with.
Oh, man.
My apologies. Okay, well, you're doing pretty good today. You're only 37.7.
Okay,
So you're
it's
actually
not
down from
too
38.
much. But that's because I'm wearing a nightie
But what happens is
and
by
a
2
shorts
o'clock in the
peak
afternoon,
winter.
you're going to hit 38.
Okay, this is like for Perth,
This is day
14
15
degrees, and it's 11 o'clock in the
of
morning. This
high
is what we
temperatures.
call freezing in Perth.
But we're working on infectious
Denmark,
disease
Western
for that.
Australia, stop laughing at me.
Yes.
Okay, stop laughing at me, because I know
Right,
that you're colder.
shirt, shoes.
Right.
She's such a procrastinator when it comes to this.
So,
Part of the OCD and the ADHD gets caught into the mix.
I've only got one brown long sleeve.
Then go with a brown long
guess-
sleeve. You can go for a white
guess-
if you wanted to.
No.
No? You want to go for a brown? All right.
Oh. No, I'm going for brown. So this basically is what I'm wearing there.
Okay.
Now, underwear and all the rest of it, you're not seeing.
They're not going to say, no,
No.
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 You need socks, jocks and bras. Let's get organised.
Guys, I am going to teleport myself in and out the shower. Hey. Lovely cardigan. Long sleeve t-shirt. Hang on.
Okay, you're going to fall over and break something.
Don't worry about the socks. They're going in white shoes. Brown tracky pants.
Okay, you look like a koala bear. Seriously.
So yeah, that's basically me. So let's continue on with the rest of the routine. Oh, hang on. Another essential item that I have to wear is... Yeah, okay. Don't be so proud to hand it to me. He's always like, oh, you got to have this, you got to have this, you got to have this.
Why am I proud?
Let's not talk about the fight about it.
Yeah, just put it on.
We argue about it because it's... You're crooked. Stop drinking in the morning. You might be evening. Drink. Go for it. Sorry about that. You could be watching this at night time. Is my Medi alert. But I made it a little prettier.
Of course you did.
Because nothing for me, it's... I've got a QR code. I've got a QR code. I'm special.
You're a quick response.
Right. They scan that and they go, oh yeah, she's a goner. That's what they'll do. They will. They'll look at it and go, there's no point. This is...
Honey.
Anyway, I'm joking. I am joking, guys, and you know I am. Dark humour, yes, but humour not the same. Right, now that plant, don't worry about the height of it. It's going to go up. So the $2 pot, which I should have left a sticker on and kept the receipt and said, can I exchange it for the larger pot? Because it wasn't used, as in it's in exactly the same condition as when we bought it. There's nothing dirt on it. There's no house dust on it. It's only like a day or so ago. Anyway, it happens, right? But let me do my favourite neutropenic routine again. So as I do that, shall we chat? Let me just lower you down a little bit because you're looking a little bit high up there. Oh, sir coming into conversation. So he's all excited about respiratory, are you?
I am not excited at all.
I got him a torch, but guess what? He's got more looms.
I'm brighter than you.
I
can say no more.
He actually is. So just stop showing off.
Just wanted to quit because as I get ready with
it is not
me,
a competition of IQ. Just because yours is above mine.
Who's a bright spark in the house?
Then again, they do say, but then you're autistic
lights are on, but no one's home.
I was about to say, like, autistics have a different test for IQ because you're right, whoever in the comments, you can't test IQ, right? Social age you can, guys, by the way. Development you can measure. There is human development that goes to zygote, which is the first implantation, to death. That is considered human development. So, yeah, there's that. They can measure that. But basically...
Yeah.
Why are you taking away from my psychology? He's got more looms.
We've worked out that I'm brighter than you. Moving on.
We don't know that. And you're autistic too, but you are like... There is no low and high functioning autism, but...
There's good days and bad days.
You do better with yours than I do with mine.
I just wanted to know.
Mine.
Okay. As you're getting ready, and we are doing a get ready for me to go to the hospital, I'm just wondering who else has to actually prepare as much information.
Yeah, I'm wearing my cross to go to the hospital because
honey,
don't trust them.
I'm wearing my cross. I've got the holy water.
Because you don't trust them either. See? See the lack of trust? We've got to bring Jesus with us. Thank you, Jesus.
A bit like that. I wanted to share what we actually do take to the hospital. So apart from obviously taking a oxygen concentrator to a pulmonary test. I know it's funny, isn't it? But you actually have to take your own devices and medications and equipment in case you actually have an issue on the way or in clinic.
Put that in the hole. Oh my God.
Okay, can I have this other part?
Put it in the hole.
Can I have the other? Can I have...
Put it in the hole. Put it in the hole.
Can I have the...
Put it in the hole. Mayfield, Mum.
Can I have...
Put it in the hole.
Okay. Why? Okay. Why are you Touretting?
I don't know. Actually. I had a bad night.
Oh, it's going to be a good day, isn't it? Can't wait for this clinic appointment, can you? No.
My oxygen stats are bad again.
So,
fluck
your hair needs to go out.
But guess what?
Your chain. Thank you.
But guess what?
Give me 3 minutes.
Guess what?
And then you can guess what.
It was a higher in the 30s, and also
your heart rate was.
Yeah.
Yeah, 35's high. Okay, sure. In which world?
Is that the right way round?
That's lovely, honey.
The other way around, it says something. What does it say? Because since I bought it, which
always
he bought it for me a long time ago.
Believe.
Right. So he bought this for me a long time ago. I forgot about what it. Well, I might have read it, but I don't remember reading it because I saw the letters then, and I'm like,
your memory, unfortunately, because of lack of oxygen.
Who knows?
Thousands of seizures has deteriorated cognitively in many ways. Now, just give me a couple of minutes while you're brushing or whatever you're doing. I just wanted to show them briefly what we are having to take in preparation.
I'm showing them my neutropenia routine.
Okay, so in preparation, we've also got all of the actual clinic letters. So 2 different clinics we're going to today. So we have to take all the information, what the actual testing is going. So there's a lung functioning test, spirometry, TLCO, the lab we have to go to, a blood test, a range of things that are happening today.
girls,
We've got
calm
the
down.
previous letter from the previous respiratory specialist, so there's a continuity of understanding what's been scripted already for
You're not
oxygen.
going to the zoo.
There is the information from St. John's, which is talking about acute oxygen crisis care and what the threshold limits are, so that we're all talking about the same page, where supplementary or complementary oxygen should be being applied, and obviously managing Dyan in a crisis
That's why I'm so
acute
stupid.
condition at home,
I've got no
because obviously
oxygen
between
going to here.
dystonia and obviously seizures and other things along the way, we need to be on the same page.
That's me.
Now, because Dyan's got a rare genetic chromosomal condition,
That's so
22q11.2
much fun with
deletion
the whole
syndrome,
thing. Oh, look.
it's a microdeletion on the long arm of the 22nd chromosome, missing 30 to 50 genes, 3 million DNA building blocks, and of course that affects about 180, 185 clinical symptoms possibly for the patient. Well, this is the Genetics in Medicine official journal of the ACMG, updated clinical practice recommendations for managing adults with 22q11.2 deletion syndrome. This is as of 2023, it's the most up-to-date version that we have. I've also got 12 other different clinical guidelines.
Alcohol, by the way.
With this, it has information on pulmonary, because when you go to a specialist, and Dyan's now got 23, 24, I think. 24, yes, we've ticked over. She's got 24 separate specialists. No, it's not a good thing. It's really lot to manage. And this is the catch-22 situation. We've got so many different areas to manage. Most specialists will have no idea, have never seen a patient with 22q, have certainly not read the guidelines and know how to manage it. BYO, we have to bring our own information to educate and advocate as we go along. Obviously, Dyan has a seizure log, and that indicates everything that's going on for her critically between dystonic storms, Tourette's tic attack episodes. Obviously, the seizures are multiple different types, whether it's atonic, tonic-clonic, focal aware or impaired awareness, myoclonus. Any of these things can have contributions to causing respiratory distress. So we have to log it, and that's documented with information on what happened. You know, what did her heart rate do? What did her respiratory stats do? What was her blood pressure? How long was she in a seizure for? Did she have aspirations? Was she cyanosis with blue lips? You know, did she have struggles breathing? You know, all of those interventions are all documented here.
I might as well take the seizure now.
Yes, you can certainly take your sodium valproate right now. Thank you very much, Steve. Google will tell you in about 10 minutes to do so anyway. Hospital information and data. Funny thing is, we're going to a hospital who they don't look at their own records. So we have actually brought together the records from the hospital, and being an inpatient or in ED, we've got all the data on Dyan's oxygenation crisis met calls, which is the medical emergency team, cardiac drops or spikes, so that they can see that in conjunction. And then we have all the reports data. These are all the separate reports printed out just for the last year. So this year, actual calendar year from January through to now, these are just the critical reports, I won't put that in context. When Dyan's oxygen is, just as low as 82%, just as low as 74%
And the
oxygen
therapeutic's
saturation.
92 above, isn't
So,
it?
yeah.
To be like, you
92 and above, you need to be absolutely for your condition,
Otherwise,
because you don't have an underlying, like COPD or anything like that.
It's not like emphysema. It's not like COPD, wherever
Correct.
that comes from. Don't even know. I don't think it's just smoke. It's like I don't know.
No,
what.
there can be other
Some
conditions that
just
can
people
cause that.
develop. Anyway.
Then we've actually got all the medical files that we need to take along to each appointment as well. These include, all the different referrals to all the other specialists, because the specialists might ask us, oh, look, you need to actually see vascular or cardiology or neurology to deal with the condition, because that's the underlying cause. Yeah, Fred, no kidding. Well, there's a referral. You can also do an internal referral to escalate and make sure care is happening as well. Then there's all the other information about Dyan from the NDIS side of things, management, inpatient, medical history, a whole lifetime of history and information, because you just never know what they're going to ask you on the spot. And of course, you'd think that, look, most of us, if not all of us, has obviously already been supplied to them in digital formats, in printed formats. It's all on their CMS system for Dyan, but they don't bother reading, they don't bother accessing. That's the difficult part of it. So that was just bringing you up to speed what we have to prepare, and you bring in your headband. That's an important thing to take to hospital. Okay, so that's the preparation that we have to do. Obviously, there's a lot of collating of the reports, there's a lot of printing it out, putting it in a way that's obviously organised and structured,
Can you be my mirror?
so that you can get through the appointment very, very quickly to manage all this. All right, that's me done. You are organised. Looking nice.
So
I like that
have
headband.
Organised. You like the headband, do you?
That's pretty. I think
Is
that's
that-
nice.
It's at the end of it.
Do you mean the end of it? That's the end of
Connection,
it. You
okay.
have to rotate it around.
You didn't tell me to do that, so you missed a step. Guys, this is what I mean. I need prompting. I only felt it, and I was like, what's wrong with me? That's what's wrong with me. I need people to tell me, otherwise I'd walk out the door with, oh, I have put my jumper on backwards. So many times. Like, when it started happening, because I've had a lot of regressions because of my seizures, when it started happening, yes, we thought it was dementia. Yes, we were speaking to people, and they were like, oh, this is not looking good, you know, this is... Where's my glitter pillow? Anyway, my glitter pillow, sir. Quick, my glitter pillow. My glitter pillow. Don't tell them about the Shein haul that's coming soon. Leave that there. I don't even know what's in there. Alright, I'll hide the man pillow over there. Make it like it's my room only. Ha! Alright, so basically there is a Shein haul coming, okay? Because I don't really know. And I made an accident last night, and everyone's accusing me it's not an accident. Except for my carer this morning. She's a Shein lover, and she backs me up.
She calls it an accident. I'd call it a happy accident, but
it was a happy accident. It's a happy accident. Not happy in the sense of I don't like... I'm $2 in the red. Okay, I have a budget that's strict, okay? And I'm like... Because I bought resin, you see. And of course, Pam, I got the right resin again. I went back to my normal resin. Who, by the way, resin company... Okay, what's with going up to $90-something for 3 litres? I used to pay $37, $38 for 3 litres. That was like 12 years ago though. Or 10. Or 8, I don't know. Anyway, it's now 92, 94, 96 sometimes. You change your mind. I guess it's the petrol delivery, because that's delivery included, guys. Now, if you want to know what resin I use, let me know and I will go and have a look at it, because I don't have a good memory and I will tell you, or even put a picture in the community page. But it is a good one, and it is cheaper than art resin. Art resin is a luxury. That's for rich people, okay? Us commoners, we don't get that. But what you do is you make the most of what you've got, and that's what I like to do. And so I have used this resin after a really lovely resin artist in Australia, Queensland. But she stopped doing videos because she obviously got some kind of life. Jealous. I will get a life. You watch. You watch me. You watch me, okay? I'm onto it. Everyone here is onto it. We're all onto it. It just takes time. Everything takes time. And at the moment, I've got to focus on stabilising my heart, which should stabilise my respiratory. Because everyone knows it's connected. Everyone we're speaking to is like, it's connected. But the process you have to go through, stupidity personified. Yes. However, we shall do what the game is, which is stupid. We all should be complaining and going, isn't that a waste of taxpayer money? Yes, it is. And here I am too. I haven't even finished the sleep stuff I thought I had. And then I was like, hang on, I've got mild narcolepsy. Can we talk about that? Because, you know, what if there's a remedy that gives me more energy? I'm still going to look into that. But Sir's been too busy looking at the heart, the dangerous stuff. As he said, critical, or whatever he called it. Such a drama queen. No, he's not actually. I am really at risk, all right? I should be in a hospital. This is fact, really. But anyway, I'm glad I'm not, and I'm being cared for very carefully, so don't worry about me. I'm blessed in that way. I've got people with me at all times. But lately, a little bit not so much, but I think I'm going to fix that. I think we've worked on fixing that. You know, staffing is difficult. It's not the staff's fault. It's not the participants' fault. It's just scheduling is a nightmare. I think that scheduling needs to be put up there with being in the control tower of planes. Okay? So, I'm just going to say that. It's up there with the stress level. Can you imagine doing scheduling for... Oh dear. Ooh, is that a policeman? We're sort of not far from the city. Yeah, okay. Uh-oh. Yeah, middle finger. Sorry. I don't know why I use my middle finger for this, but I do. Weird, right? Anyway, I have a condition that makes me very dry. Dry eyes, dry sinuses, dry nose, dry lips, dry mouth, to the point where I can't even swallow. Oh, I need a tissue. This is ooey gooey. Sensory nightmare. Okay. Interoception's good, isn't it? Because it makes you just, at first you just don't feel it. And then all of a sudden you're just screaming your head off and everyone around you's going, what's wrong? What's wrong with you, mental lady? I'm just autistic. I've got something gooey on my fingers and I'm going to die. It's dramatic, right? And then you wipe the goo off and you go, that was funny. And the person's like, oh my God, you acted like you were dying. It's like, yeah, I kind of did. Sorry about that. That's autism anxiety, okay? It's pathetic. We just, in the moment, go, rawly react. You know, like raw food, raw, R-A-W. We're very raw people. So we just speak our mind, which add stress in there is not a good thing. Because this dude, if it's this dude that I'm seeing today, let me just tell you what, I have to bite my tongue without causing blood. I will be careful. I know that's very literal and dark. I'm so sorry. But basically, this is the same dude that when we first had oxygen, that the doctor's like, yeah, that's not good. And we said, look, we're seeing respiratory for sleep anyway, because I had a lot of problems in my sleep test. Like, there's a lot of problems. The sleep area of the brain has calcium on it, so that doesn't help me sleep, does it? They're going to drug me like a horse, pretty much. Yeah. It's amazing I'm not the size of a whale, but I've got a good doctor. Be careful with psychiatrists for sleep, because they give like dangerous types of drugs. This is for entertainment purposes only. I'm not a doctor. But it does. And there's always other things to look at so that doesn't happen to you. Because when a female, everyone wants to choose their weight. Everyone has the right to choose their weight. So I'm not going to sit here and say fat people are bad, skinny people are bad. That is rubbish. I believe in you being totally who you are. That's it. Okay? It's about who you are. It's about if you're a good person or if you are a mean person. This is what I sort of measure. Are you mean to me, good to me? Are you mean to others, good to others? I don't know. The whole thing, I focus on that. So I don't really advocate for the weight thing. But what I will say is you should be able to choose what you want to look like. Just like with our hair and with our clothes. And it's a choice. So that's pretty much all I have to talk about. But yeah, like this is the doctor that, this is what he said. He said like, because I said, we've just got these reports from my watch, which is a medical grade watch, because the NDS doesn't buy ones that aren't medical grade, okay? So I said, yeah, I'm having oxygen saturation levels low. At this point it was just seizures, and then it ended up being, and then I said to him, and then like the doctor's written something to you about that, but since that as well, I've got more reports that, and Sir said, I've sent them through to, there's a team at the hospital you can send it through to, which the specialist can access. So he said, I've sent the reports through of now recently out of seizures that my oxygen was going really, really low. Below therapeutic levels, this is concerning, and the GP wants her seen. And because we were already, and when he rang, we didn't even know what he was ringing us for anyway. We assumed, actually. We did assume, naturally, because there's a referral just being done, and being a complex patient, I just thought that he was just ringing and saying, we're going to talk about the oxygen levels, because that's not good. Like my doctor feels, is not good. It's really not good, guys. And the stutter that I've got, it's not good. And so basically, and the levels that I'm going to during the night, that's why the Met calls were happening in hospital. Every morning they'd come in and wake me up and say, I've got to check your blood pressure because you're in the 30s. And the nurses are like, we have told those doctors to not send you home. And yeah, and because we see too many different specialists, which is stupid in our public system in Australia, that each neurologist is different. And this neurologist was like, yeah, you got dystonia, but I don't know what to do about it. I'm like, Google it, idiot. Can't you at least Google it? Okay. There is actually a rare, anyway, there is a rare little flow chart that doctors have, specialists have at their hands, but they're not aware of it. So if you're a rare patient in Australia, please get in touch with us through email if you wish to ask what the rare, I think it's like an association or something, and they have an outline of what should happen for each rare patient. Because a bit like when I talked to Professor Lynn Beasley, I've met her twice, had lovely chats with her twice. She was at my art exhibition and she spoke for me for my 22Q. And also, I met her again at a function, which was wonderful. And she said, if you put all the rares together, it's not so rare. Because a lot of rares have overlapped symptoms like seizures, sleep issues, autism, ADHD. And ADHD in a 22Qer is like ADHD on steroids. So yes, my doctor's now saying, go to the psychiatrist. And he doesn't even believe in them himself, because they do, this is for entertainment purposes only, but they do push drugs. I don't want strong medications that affect me. I only take what I have to take. That's just how I am. So yeah, but basically I've got to go from ADHD. Try the medication, see if it works, but I don't reckon it will, and I'm not really keen. But you know, I will give everything a go, because the studies do say that 22Q ADHD we do struggle bad. And like, I had it bad through perimenopause, which I started very young, and through menopause, and now I'm postmenopausal, and it's bad. Sort of hormones do affect your ADHD. Please understand that. So if it's, you know, that time of the month, understand if you've got ADHD, then you're going to have problems. So communicate to the people around you and say, please be kind to me, because it's called hormones. I'm a woman and I produce humans. Okay, and you men, you wouldn't be here without us. Okay, I know you could say like the chicken and the egg and all that thing, but I'm just saying, we do most of it. Ladies, don't forget that. Children are a full-time job. You are a massive, important thing to those humans that turn out to be amazing taxpayers and society members. So to you mums out there, I salute you. Keep going, keep pushing. I know it's hard, but you will get your respite, so to speak, because empty nest, it's weird. You get to that point and then you cry, you want them back. And then you get past the empty nest grieving. It took me 2 years. Oh, I grieved hard. And then I was like, oh, hang on. And now Sarah and I, it's like we lived together before we had kids. It's now like that. It's really good. So there's pros and cons, but of course you miss it, but at the same time you don't, because you're happy that it's over. You've gone through all the phases, and then you and your partner get to get back to who you were, back to your hobbies, interests. It's not all bad. It's not all bad. So if you're heading there, it's okay. And especially you disability mums, okay, it's tough being a disabled mum. That needs to be respected. And it's tough for the children too. They go through a lot of medical trauma, and you know, it's not easy on them either. They're better now dealing with those children, but when my children were going through it, there wasn't any supports available for me, let alone them. So once again, if you think there's no improvement, I agree, but I want you to think of that. Okay. Love you guys. Bye.